Evening, everyone, and welcome. I am Janice Brodesing with the American Academy of Anti-Aging Medicine. I want to welcome you to tonight's webinar, Menopause, Andropause, Improving the Health and Happiness of Your Patients with Bioidentical Hormones, featuring Doctors Rosensweet and Wright. And first off, I want to say thank you to everyone who's taking the time to join us this evening, taking time out of your busy schedules, and I'm sure very, very long days. Before we get started, I want to place everyone at ease. We will be recording tonight's webinar, and the recording of this will be sent out to the attendees within a week. Should you have any questions for this throughout this presentation this evening, you'll notice there's a chat box on your dashboard on the bottom right corner. If you would be so kind as to enter your questions in that dashboard. If we have time at the end of the hour, I will present them to our doctors. And as I mentioned this evening, Doctors Rosensweet and Wright will be presenting, as well as they'll be teaching a full day workshop on this very topic at our very exciting upcoming 24th Annual World Congress, May 19th. Through the 21st in Hollywood, Florida, where I guarantee you temperatures 80 degrees and white sandy beaches. I would like to take a moment this evening to introduce our very dynamic and passionate presenters. I had a moment to chat with both of them prior to opening up the call this evening, and I can tell you the enthusiasm and the passion with which both of these doctors have for this type of medicine is really remarkable. And I know that it's going to come out and you'll be walking away with lots of nuggets of wisdom. Dr. Rosensweet is an expert on menopause and natural hormones. He teaches treatment of women in menopause with bioidentical hormones to physicians. He also leads an ongoing seminar, The Healing Process. Dr. Rosensweet currently has a practice in Naples and Sarasota, Florida, and does consultations with patients and physicians all over the world. Dr. Wright is the medical director of the Homer Clinic in Renton, Washington, where he also practices medicine. He's a graduate of Harvard University and the University of Michigan. He began his private practice in 1972. And with Dr. Gabby, he has taught nutritional therapy since 1983, revolutionizing the medical practices of thousands of physicians. Dr. Wright is recognized as a pioneer and innovator in this field of nutritional medicine. And without any further ado, please welcome Doctors Rosensweet and Wright.
Good evening. Good evening to you, Jonathan.
And thank you, David, and thank you for everyone who's listening.
And, you know, tonight I'd like to ask you a few questions, and I'd like to start with one of your major interests that I know some things about, and it's really related to the treatment of young men when they have symptoms of hormonal decline. And you've spoken about the restimulation, and would you talk about that a bit?
Sure. As you know, or some of you know, I've been doing the bioidentical hormones since about 1982 or so. And to begin with, mostly women would come in, and we've seen an increasing share of men now. Some of those are younger men. And what do I mean by younger? Well, let's say 50 and under, and for sure 45 and under. And testosterone levels are low. And they're wanting, well, what am I going to do? How about a testosterone prescription? My general approach is to discourage taking exogenous testosterone, the younger one is, and to try to get one's own testosterone going, because obviously it's best if it's made internally in hopefully an optimal way for that man. And so who needs to take what I want to say is, who needs to take those testosterone from the outside until we're of a much more suitable age? And there are two steps in getting that going. One is de-repression of the guy's own testosterone. Now, what we all know about that one is that there's all of these environmental estrogens, xenoestrogens as they're called, that are in everyone's bodies. In fact, they've been shown to be in the fat of penguins in Antarctica. And nobody is spraying Antarctica with pesticides, but yet there they are. And so those have to come out. And then there's this burden of toxic metals that both of these things, as we all know, I'm just repeating what we know, are almost all part of modern civilization, except we have to admit that the Romans unknowingly poisoned themselves with lead. And while they were doing that, they poisoned their testosterone. As everyone knows, lead and cadmium and other toxic metals will keep testosterone from outputting as well as it might. So I'll encourage them, look, you've got to get all that toxic stuff out of your body to the best of your ability. It's never going to be perfect. And that involves two things. One, sweating. That really helps to get most of the environmental chemicals, pesticides, that sort of thing out. And the other one is, well, most of us are familiar with chelation therapy, so we do a chelation trial and find out what sort of toxic metal burden this young man has. And sometimes it's not too much, but sometimes it's pretty darn bad. And that has to be chelated out one way or another. And it really doesn't take all that much sweating. There's a study done with fat biopsies before and after, showing that after 30 episodes of 30 to 40 minutes of heavy sweating, 2/3 of those environmental chemicals were gone from the fat. So, and then one just keeps it up. So anyway, we've got to get the impediment out of the way. And then something, I'll shut up in a moment, I promise, something that we'll be going over at the seminar is there is research on, I forget whether it's 9 or 10 specific nutrients. That's before we ever get to botanicals. These are essential to the body nutrients that can stimulate the internal testosterone production, but there's no point pushing as if we were going down testosterone alley if we've got this big barrier in our way called toxins and environmental chemicals. So again, it's 2 steps. Get the bad stuff out and then stimulate the good stuff. Time for me to shut up.
Oh man, that's so interesting. It's so profound, the level that environmental toxicity can play. I was even listening to the news tonight and wondering if what seems to be more gender ambivalence, I wondered, was there a way that the birth control pills that have made it into the water supply and the petrochemicals and the heavy metals have really affected gender expression? What's your opinion about that?
Well, my opinion goes way back to the Price Pottenger Nutrition Foundation, who sells books by Weston A. Price and other pioneers way before us, David, in the natural approach to healthcare. And one of those doctors, in his book that the Price Pottenger Foundation carries, shows pictures of men taken from the backside with their undershorts on, that's all, at various decades. And he's pointing out there's actually a difference in shape of the body conformation. It's not a giant one. I mean, men are still men, but it's different at different decades. He started in the early 1900s and made it through the 1950s, and even then he was seeing a difference. And we didn't have near as many environmental chemicals and pollutants then, but what he's pointing out is the change in diet, because there was quite a shift over from our remote ancestors to the early 1900s in what people were eating.
Fascinating, big topic.
So, Dr. Rosensweet, tell us a little bit about the importance of bioidentical hormones for women, all the different things that women need not suffer with the use of bioidentical hormones.
Well, there's the short range of almost sure thing, and when a woman is interclimacteric, which nowadays can be anywhere from even the mid-30s to the 50s. And as these hormones start declining, the ovarian hormones, my goodness, women feel it. I mean, these are powerful and supportive biochemicals. And as they decline, there's the surface symptoms, I call them, you know, the hot flashes and night sweats. But this is not what's really troubling women. I mean, you get into some of these hormonal declines and you get sleep disturbance, mood disturbance, sarcopenia eventually as you lose the androgens, of course, osteoporosis, and you know, in our seminar, of course, I'm going to go into a great many details about this, but the consequences of these hormonal declines in women who are in general living longer, they're very substantial. Women don't like them. And many of them will certainly brave their way through the surface symptoms of the hot flashes, but you lose 3 nights sleep and you're an empowered woman leading an active life, and your mood is changing, and your libido is changing, and you're losing muscle strength, etc., and your levator ani is no longer supporting your bladder as well as it used to, especially as time goes on, and you get into some of the incontinence issues and the diapers. I mean, the list goes on, as you know. And the replenishing of these hormones, it's so dramatic. You know, it was one of the things, one of the ways that I took such a path into this work, because women were so appreciative. Just a little bit can make such a huge difference in a woman's life, and it certainly can in a man as well. So, my goodness, it isn't just let's alleviate symptoms, it's prevent some of the severities that can occur, especially in the 80s and 90s. And when the women lose their strength, they can't keep their balance, they're using walkers, their bladder is giving them all kinds of trouble. We want to prevent these issues so that women can live long and think clearly, because I had left out what can happen to the mind with the loss for so many of these women. So the list is long, and the treatments are, once you learn how to do it, and you do it elegantly and as safely as possible, you can make such a difference for patients. It's one of those big things as we apply biological and natural medicine to treating people. It's one of the big things that can make a difference for people. It's so rewarding to the patient, and thus very rewarding to us.
Yes, and one of the things that Dr. Rosensweet is going to let me talk about ladies' health, I'm just going to be talking about guys, is the enormous importance of estrogen to women's lung function. I'll almost leave it at that, except to say, why is it that for every one man who's a non-smoker ever, who has COPD, why is it that there are 7 or 8 women who have COPD amongst non-smoking women? Again, we'll leave out the smokers here. Why is that? Could it have anything to do with estrogen? Let's leave that for the conference, but it certainly does. And there are preliminary experiments showing that actually a lot of that can be reversed.
And how huge is that? I mean, what correlates more with health into the elder years than lung function? It's right up there at the very top. So giving a woman the gift of treating that and preventing those pulmonary changes, it's wonderful.
Yep.
So let me lead you down another trail, because in the world of testosterone and treatment with testosterone, there's some anti-carcinogenic substances emerging, and would you talk about that?
Well, actually, they've been emerged for over a decade. The problem is that, well, we won't get into the politics, but a certain government agency is keeping them from coming into our country. What I'm referring to is the very, very solid research on an anti-carcinogenic testosterone. It's a metabolite of DHT, which is, of course, said to be pro-carcinogenic, and it is, in fact. But just as with women, if their hormones are balanced with more anti-carcinogens than pro-carcinogens, they have a lower risk of cancer. The same thing goes for guys. If us guys have a higher amount of this anti-carcinogenic estrogen, which, by the way, is testable. One can test one's patients for pro and anti-carcinogenic testosterones. And if his level is low, well, for about 6 months, about 3 or 4 years ago, the compounding pharmacies were able to import from German sources the anti-carcinogenic testosterone. They could put it into little creams, and we could treat guys with prostate cancer, and oops, a certain federal agency cut that one off. So what we have to do now is, very fortunately, there are known ways to increase the anti-carcinogenic testosterone endogenously so that our bodies can make it from the inside. And I'll certainly be detailing that at the seminar.
Yes.
So it is a really important topic that gets no attention just because it's not available. But it's really good to know that it's endogenously available if the guys do the right things. So, David, you were mentioning risks and keeping those risks minimal. Could you go over that on any risks that you may see in bioidentical hormone replacement for ladies, and keeping those risks minimal?
Well, for one thing, I noticed early on in working with women that there was this silent question going on in them, especially after 2002, that even though they so much wanted relief, short-term and long-term, from the hormonal deficiency, they were frightened of breast cancer. Of course, that exacerbated humongously in 2002. And so early on, I realized that I needed to dive into the medical literature and really explore the whole topic of risk of breast cancer, really, because that's the biggest concern. And it's a fascinating journey. And of course, in the seminar, and also we provide references, because I feel like anyone who's practicing menopausal medicine wants to have their backbone supported by a knowledge themselves that what they're doing is safe and not risky. Now, we all face risk of developing cancer. And we can minimize these risks enormously. And one of the most fascinating things to me, and the bottom line that the WHI study revealed, was that women who were taking Premarin, that's horse urine-derived estrogens alone, half of which were totally foreign to the female body, they actually had a reduced risk for breast cancer, 0.79 relative risk. It was the Prempro that was the problem, the Provera, and that was a small but statistically significant increase, and that's what put the terror through the community. But when you examine the bioidentical literature, it is clearly emerging that women who are treated with bioidentical hormones, that would be the proper estrogens, progesterone, and I'm going to assert ultimately androgens as well, they too have less risk of developing breast cancer than women who were not treated. Now, to know the details and to get exposed to the details as physicians and practitioners, it's very, very helpful. So you can sit in that office and you're never going to be able to say to a woman, oh, there's no risk at all. I'm not trying to do that. We're all at risk. And of course, the medicine that we practice, to the extent that the patients are inspired to do so, we can help reduce those risks. But treatment with bioidentical hormones, just on a very fundamental level, strengthens the being and everything that the being needs to do well and live well. And yet, and ultimately, the science takes us down to there's less risk in general with treating women with bioidentical hormones in menopause and no treatment at all.
Absolutely so. And we'd have to say the same for testosterone for men, if it's done right. And we'll detail that during the seminar.
And I think that's the crucial point, and it's why we teach various seminars and really burrow into the details, because women are individuals, and the hormone profiles and the dosages used and the type of hormones that you use, they make a huge difference. And we want to get this as absolutely right as we can. And there's a lot of details. You know, I could remove someone's appendix because I actually sat in on it in medical school, but you don't want me to be removing your appendix. You want a really skilled surgeon. And the world of hormones and treating humans with hormones is burgeoned and exploded into such a fine knowledge base that is so germane to daily practice that we highly encourage people to dive in, learn it. It's exciting, it's interesting, and it'll really help you bring to women and men the safest and most elegant that you could possibly do in the treatment of them.
You bet. And even though it might sound like, particularly if one is a beginner, it might sound that, oh, this is going to be a lot of stuff to learn. Actually, if we follow one guiding principle, and just keep in mind, are we doing according to this principle? Why, that'll guide us through most things. And that principle is copy what nature does. And that is the type of hormone, the balance of hormone, the timing of the hormones, how the hormones get into the body, all of those things. For example, testosterone goes from the testes to the heart, and it's spread to every cell in the body, and then the liver gets rid of a little bit of it at a time. Yeah, and that's why we always say, well, rub this stuff in, because if you swallow it, that whole burst of testosterone goes to the liver, and the liver just simply can't handle all that. Fortunately, with testosterone, it's not as bad as with estrogens, which can be prothrombotic because of that reason if they're swallowed. But again, I'm getting back to the basic principle. I'll get off the details. To say copy, copy, copy nature. Now, for anyone who says that menopause is natural and we're not copying nature by replacing hormones, that is quite silly, because also we did not have, eons ago, we did not have all the osteoporosis, all the heart attacks, all of the Alzheimer's disease, for gosh sakes. It was so rare that Dr. Alzheimer's was questioned. Is this for real? And now we do. So what we're doing is using nature's tools in the way that nature uses them to combat all these unnatural things. Would you agree, Dr. Rosensweet?
I sure would. And there's a tremendous amplification of what menopause is these days, in my opinion, by the various things that you mentioned when you were talking about young men and how they've been affected in their testosterone production. There's all the toxin, there's all the toxicity, and there's all the stress, and there's a amplification of the diminishing of these hormones that is taking place in modern times, I believe, as well, to compound things. And then copy nature. Oh my God, what a earth-shaking principle that is.
Come on, it's easy. It's easy.
At the same time, we want you to know that Dr. Wright and I are not copying nature in the sense of restoring or keeping going women's menstrual periods. What people don't realize is it takes between 3 and 8 times the upper limit of normal of young women's estrogens to keep that happening. So we go into detail about that as well, so that we get you on the safest protocols for these women. And it's amazing. It doesn't take much to accomplish what we really want to do for the mind, for the vagina, for the bladder, for the muscles. So we do want to let you know that in that sense, we're not going to push a woman into the tremendously excessive doses of hormones it takes to keep those periods going.
That's totally unnecessary besides, and we'll explain during the seminar briefly, very briefly, because it's not the main point, how one can, and by the way, this is research verified, reduce one's risk of heart attack and stroke quite dramatically without having menstrual bleeding.
Absolutely.
On that note, Doctors Rosensweet and Wright, I would like to ask you, you have mentioned many nuggets and on having us dangling on them, alluding to the workshop that you will be teaching. The question that has come up for the upcoming workshop in Hollywood at the World Congress, and I will address this to both, to each of you, a little short synopsis. What would be the biggest takeaway for the physicians in coming and exploring this topic in greater depth the whole day? There is 8 hours of CME credits that is able to be earned as well. So what would you say to the listeners, to the attendees this evening, would be the biggest takeaway for them in coming to dig deeper with you in Hollywood?
May I begin, Alphonse, with this?
What's that, sir?
May I begin, Alphonse, with this?
Oh, go, Gaston.
We are Monday morning oriented because we're both practicing physicians, and we know how crucial it is that the doctors that attend our seminar walk away with as full a tool bag as we can assist them with the practical. This is how you do it. These are the details. This is how you make your Monday morning and your approach to women and men more practical than ever before. So we want to let you know that although we are science-based and refer to it frequently, we want to get you into what matters in an office, and that is, how do I do the details here? What are the specifics of it? And we've done this for long enough that we've got pretty much the basics down very solid, and love to communicate them because that's what doctors love. I think one of the things doctors love by attending our seminar the most is they walk away with, oh my goodness, I did learn a bunch that's relevant to my day-to-day practice. Gaston?
Thank you, Alphonse. Yes. Dr. Rosensweet and I are both practitioners. We're not academicians. That doesn't mean that we don't study the science. Both of us do. I think our wives probably get bored with all the studying we do, but we make up for that in other ways. We're basically practitioners. We apply this in the office daily. I want to expand on that to say this seminar is going way beyond estrogen, testosterone, and let's call them sex steroids. We're also going to be talking about, let's see, thyroid and a number of things having to do with thyroid. We're going to be talking about insulin resistance because, believe it or not, it is a very big deal for both men and women's sex steroid treatments. Everyone knows this, but we have to learn to take a very hard look at it. Everyone knows that if one is genetically predisposed to type 2 diabetes, that one has an excessive insulin signal in response to the same amount of carb that if eaten by a person who's not genetically predisposed will raise the insulin a little bit, and the same amount of carb in a genetically predisposed person will raise it a whole lot. And what difference does that make? Well, we've all heard of insulin activating aromatase. I don't know why anybody named that enzyme that because it doesn't smell good, but that's what it's named. And that will drain away a man's testosterone. It will, that aromatase. We've all heard of man boobs, to be polite about it. It doesn't have to go that far to give a guy problems. Just because he is predisposed to type 2 diabetes, and by the way, 1 in 3 guys is, there's data on that. Give him testosterone, a lot of it ends up in the estrogen corridor. What good is that going to do? But I know I'm talking fast, but this applies to women too, because women need those androgens, as Dr. Rosensweet said, for keeping the muscle mass, among other things. And if too much of that goes away and turns into estrogen, well, fine, it'll do her the estrogen good, but she hasn't got her androgens left. That's not good. So when we talk about insulin resistance, we're going to be talking about several facets of thyroid treatment. And one other thing, yes, I have been doing bioidentical hormones for about 34 years now, but as was kindly mentioned at the beginning of the seminar, I do a heck of a lot with nutritional biochemistry, as it's called. And one of the presentations will be talking about aspects of women's health care that has something a little bit to do with hormones, but has a whole lot to do with such things as how do you help the ladies stop having clots during their menstrual cycles and hurting and being in pain? How do we get rid of menorrhagia? And it might sound hormonal, but it's all nutritional. And we'll be going over that. It is possible to get rid of clots from every woman's cycles altogether. And it is also possible to get rid of menorrhagia. What's the percent? It's 92% of the time, either totally gone or a significant improvement. So we'll be covering those aspects too, the ones that come in along with the hormonal treatment that women want. We can do those things, and excuse me, what are you doing stopping clots if she's postmenopausal? Excuse me, we all see premenopausal ladies too, and it's useful there.
I love how...
Well, thank you. Go ahead.
Oh, you go ahead, please.
I just wanted to say thank you so much to the two of you for spending this time with us this evening and presenting this evening's webinar. You've certainly shared with us your wisdom and teased us with even more some nuggets. And I would like to thank you sincerely and also encourage everyone that has been on the call this evening that absolutely loved what they heard to come out and join us in Hollywood in our upcoming World Congress on Anti-Aging Medicine, where you can enjoy a full-day workshop and have FaceTime with our two very amazing and innovative physicians, as you heard this evening, on this very topic. I would also like to extend to each one of you that was on this call this evening $100 off towards your workshop registration. And for that, you can give me a ring tomorrow in the office, 561-997-0112. I will be seeing my anti-aging physician first thing in the morning, so probably best to call after 9 after being on this lovely presentation this evening. Again, thank you so much to Drs. Rosensweet and Wright, and thank you everyone, and have a lovely evening further. Bye-bye.
Good night, everybody.
Good night, everyone. Thanks so much, Janice, for hosting us.
Thank you so much, doctors. I look forward to seeing you in Hollywood.
All right.